Serving 885,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-chah-nulth cultural families. The Island Health family includes 30,000 healthcare professionals and 1,000 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities with more than 6,700 long-term care beds, over 1,600 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3 billion. Each year, this funding supports 561,000 visits to emergency departments, more than 73,000 surgeries, nearly 60,000 MRIs, 158,000 CT scans, 2,100 telehealth visits, more than 85,000 visits to urgent and primary care centers, over 17,000 home health monitoring visits, 314,000 visits to ambulatory clinics, and 478,000 home health care visits each year. Island Health has expanded our primary care services with 23 primary care sites across our region, including 7 Island Health urgent and primary care centers and 9 primary care networks. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Our public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments. From birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
I love that video. I really like watching it. It's so great to give that explanation to people. And I saw Kathy writing this down. Our budget is actually closer to $4 billion now. So we're growing substantially. Anyway, good morning. I'm delighted to see you all here. I'm Leah Hollins, the chair of the board of Island Health. And on behalf of my colleagues, welcome to our public forum, whether you're joining us in person here at the Harbour House Hotel on Salt Spring Island or online through our live stream. We are gathered here today on Salt Spring Island, a shared island between multiple Coast Salish nations. Traditionally, it was understood many nations were welcome to hunt and gather here throughout the year. We recognize the historical ability and significance of the Coast Salish nations who share this land and care for it together. I also recognize the people from other nations who make this place their home, along with the Inuit and the Métis Chartered Community. Please join me in reflecting on the harms done, such as the cultural genocide and assimilation of Indigenous peoples, the residential school system and discovery of graves of Indigenous children who attended them, the Indian hospitals, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to think about the responsibility we each have to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility, and we demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonialism. Public forums like this allow the board to meet the people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together helps us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Because caring for the patient is why I started working in healthcare and why I continue to support the delivery of health and care. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. And it's my pleasure now to introduce my colleague directors who are responsible for the overall direction of Island Health. The board consists of 9 directors. I need to get some water, I think. The board consists of 9 directors in addition to myself, and includes Shawnee Cassavant from Hupetchesett and Sechot First Nations on the West Coast. Good morning. Ron Matson from View Royal. Diane Brennan from Nanaimo. Ann Davis from the Comox Valley. And there are 4 of our board members who couldn't be here today. Alana Nast from Victoria, Anne McFarland from Victoria, Ron Rice, who lives in Victoria but is a member of Cowichan Tribes, and Andy Adams from Campbell River. We also have our local leadership and executive management team joining us, and maybe I can just get you to put up your hands so you can see who they are. We have a very full program today. Dr. Dee Hoyano, our medical health officer, will share an update on public health and wellness in the region. We'll have a presentation from David Norgat on the Salt Spring Health Advancement Network. And the last part of the agenda will be an opportunity for you community members who have come to our meeting or submitted questions in advance. I'll open the floor to questions so the board can hear from you. But first off, Island Health's President and CEO, Kathy MacNeil, will begin by providing an update on the delivery of health and care services across Vancouver Island and here on Salt Spring Island. And I'll go away and cough.
Stay here and cough, so we'll see how that goes. Thank you, Leah. And I feel like I already know many of you in the room because we've had the opportunity to already spend some time together, but I welcome folks online who are joining us. So I too want to open up by acknowledging the Coast Salish nations who've traditionally shared this land and continue to do so to this day, and recognize Métis, Inuit, and other Indigenous peoples from across Canada who live here, choose to live here in Salt Spring Island, and who are very connected to the land and waters that surround it. I feel like it's such a pleasure to be surrounded by the beauty and tranquility of Salt Spring Island, and talking to David this morning, it was just a great reminder that to slow down, to come here and just slow down and enjoy the an opportunity to get grounded here. You are very grounded, and you can feel it. And some of us who are moving at warp speed are envious of just that pace and the ability to slow down. So thank you for sharing that energy with us today. This morning, the board members and our team had the opportunity to sit down with many of you as community partners, and we're very grateful to you for being with us this morning and also staying with us today to have a further conversation. We discussed some of the needs and challenges and some of the opportunities for Salt Spring Islanders who are trying to seek better health and accessing care. As part of this discussion, we did talk about the social determinants of health. And the World Health Organization defines the social determinants of health as the circumstances in which people are born, grow up, live, work, and age, and the systems that are put in place to deal with illness. So it's the wholeness. We talk about holistic health. It's the wholeness that actually makes up health. Local governments and community partners play a key role in influencing those social determinants of health. And I know Dr. Hoyano will probably speak to some of this later. From promoting physical fitness, supporting community programs that reduces social isolation to seniors, and we know after the pandemic the tremendous impact loneliness is having on people and from a mental health perspective. Also, seniors who are isolated still in their homes after the pandemic. And establishing places where people can come together, parks, community centers, recreation facilities where families can come and spend time and grow those relationships that are so important to health and well-being. I want to thank all of the partners for being advocates for the health and wellness of the people living here in Salt Spring and for participating in our discussion this morning. As Leah said, for our board and executive, visiting communities and being part of these forums and these conversations provide us an opportunity to hear what's working well and what, from your perspective, needs to change. These forums allow us to share some of our challenges as well and update you on the work that we're doing. Today, I look forward to a public health update from Dr. Dee Hoyano and a presentation about the Salt Spring Health Advancement Network from David Norjet, and I had the pleasure to get to know David a bit this morning. I know he'll be very entertaining. One of the focal points of our discussion at breakfast this morning was how care can be delivered and accessed using technology. You know, travel and transportation is a factor here, being an island community, and technology is one way that we can help reduce some of those challenges and the gaps that occur. I'm going to talk a little bit about virtual care and our patient portal, which improve access to care and make care efficient and convenient for both patients and providers. We recognize that it can be difficult to access care, especially living in communities that might be more isolated. And virtual care can help ensure that patients get more timely, safe, and equitable care. We also know that connectivity issues here on Salt Spring can make accessing virtual care challenging in and of itself at times. We're working on advancing access to virtual care and improving the technology. I think collectively across the world, the pandemic introduced far more virtual solutions to people coming together, and healthcare is no different. We see virtual care as an opportunity for us to help meet the demand of the populations that we serve. And so we should be investigating and exploring every opportunity that we have, especially when we have health human resource challenges across the health system. We have robust virtual care solutions embedded in all of our clinical programs, including virtual visits, remote patient monitoring, virtual on-demand interpretation services, communication solutions, and other technologies that we use. The goal is to provide high-quality services in your home and your community while supporting our healthcare teams. What are virtual visits? Well, they're visits between patients and healthcare providers, everything from specialist care to pre-surgical visits, post-surgical follow-up, right to palliative care to support patients and families at end of life. In a unique and remote community like Salt Spring, virtual care is crucial in connecting patients with health care. We support patients in accessing care on their own devices or in a secure device at their local health clinic, including ones on Salt Spring, Main Island, Saturna, North Pender, and Gabriola. Community virtual care also provides access to remote patient monitoring and virtual group education for people with chronic diseases like chronic obstructive pulmonary disease, diabetes, and heart failure. Monitoring equipment is provided at no cost to the patient, and support is available 7 days a week from a multidisciplinary team. Virtual palliative care is also available, ensuring people have access to end-of-life care no matter where they are. Expanding virtual care remains one of our key areas of focus, and we know we've barely scratched the surface when it comes to the opportunities that this technology provides to patients and their families. We talked this morning about primary care, and we know in this community that's a challenge. In 2022, only about half of Salt Spring Island residents were known to be attached to a primary care provider. And I'm really glad to say that I met Laura this morning, the new nurse practitioner here in the community, and hope we grow more Lauras to support primary care here on Salt Spring. There are 13 family physicians with full patient panels, and Laura's target is to have a panel of 800 patients. We're an active partner alongside local physician leaders, nurse practitioners, and other key community partners in developing a primary care network here for Salt Spring Island. Part of this work involves early exploration of the need for a community health center, and we heard about that this morning, and the critical partnerships needed to take that from a dream or a conversation to make it real. The Ministry of Health has approved an expression of interest to support the next phase of a primary care network, and we are working in partnership with community providers, local primary care practitioners, and other key partners to develop a service plan to address local needs. And just to say, that's the process we go through so that to convince the ministry that their investment will come to reality. So to bring those partners together to make that plan, joint plan, submit that for approval. And so that work's underway now. We're also working with our community partners to strengthen the network of patient and family-centered services available. As we know, a robust primary care system reduces demand on the acute care system. So I'm so thrilled that this spring, I know very much awaited, a new expanded emergency department will open at Lady Minto Hospital, providing upgraded facilities for both staff and patients. The expansion includes a purpose-built patient waiting area. And I think if you've been I'm sure many of you have been in the current emergency department, you know what the waiting area is. It's a hallway. And so glad that we're able to provide the appropriate space for people to have a different kind of experience of care. A new patient exam and treatment bay, and the addition of a safe, secure de-escalation room for patients in need of emergency mental health care. And that's a very important staff safety development as well. A purpose-built check-in and admitting area, so there's some hospitality that's experienced when you come into our facility, and an increased clinical space and dedicated entrance for ambulances and first responders. So people who are in crisis coming in through first responders aren't passing by people in the hallway waiting. We're also adding 24/7 protection services officers to improve overall security and support at Lady Minto. And we're so proud of the work of our protection services officers in making a safe environment for both staff and patients. I want to say, and I mean this very sincerely, how grateful we are to the Lady Minto Hospital Foundation and to this community for making the emergency department expansion a reality. You have been tremendous in your fundraising efforts. The foundation and the incredibly generous people of Salt Spring Island raised $10.4 million for this project. I'd also like to thank the Regional Hospital District, which contributed $3.7 million to the foundation as part of its fundraising for the new emergency department. Thank you for the incredible work that you've done as a community to support this initiative and for everything that you do to support this community in health and care. The Lady Minto Hospital Foundation is also stepping into new space, helping us with staff housing as we move forward this year with planned renovations to the former Seabreeze Inn, converting it to 18 new long and short-term housing units for healthcare staff. And we do hear it is the #1 issue that gets in the way of recruitment is housing pretty much across Vancouver Island, but very unique here on Salt Spring. So very grateful to that, to the Healthcare Foundation for that work. The housing initiative is just one of the many things happening to support staff recruitment and retention. Numerous retention initiatives are underway, including advanced education and career laddering opportunities, with initiatives like team building, cumulative stress and resiliency training, and diversity and inclusion initiatives. We've been working with the provincial government to expand BC's health and human resources strategy here on Salt Spring Island. Go Health BC is now scheduling nurses to come and work on Salt Spring Island. Go Health BC is an employee travel nurse program where nurses outside the BC health system are hired into roles within Northern Health and then deployed to various rural and remote locations across BC. And I just need to say, it's really important to have clinicians and providers who are used to rural and remote environments to practice. So Go Health BC focuses on recruiting people who want to work in those environments, and that's what makes it successful. Building on successes in the North Vancouver Island, Island Health has also applied to expand the provincial rural retention incentive to Southern Gulf Islands, providing a financial incentive every quarter to all employees who take a regular position with us. We also have staff appreciation events throughout the year, including fun activities like welcoming staff and their families to a movie night at the local theater, camping trips, and staff barbecues. The Lady Minto Hospital Foundation generously supports all of these activities. I also want to thank the staff at the hospital itself and in our long-term care. The two chiefs of staff, Dr. Christopher Applewaite, who was here with us for breakfast but has now gone to heal the sick. Dr. Anik Momsen-Smith, I don't think Anik was with us this morning. And Aaron Price-Lindstrom, who I know many of you know here. Aaron's a tremendous leader here and advocate for health and care. I just want to thank you publicly for the hard work that you do, the dedication, and for leading change. It's not easy, so thank you for that. The seniors population here, so seniors, I'm soon to put my own hand up here, 65 years and older, is growing faster than any other age group across Vancouver Island, and Salt Spring is not different. 1 in 3 people here on Salt Spring Island is over the age of 65, compared to 1 in 5 people across the rest of British Columbia and the national average. So along with the Ministry of Health, we are working to meet the care needs of this growing senior population. For us, helping keep seniors well at home is an absolute priority. We have an incredible team at Island Health's Community Health Services based out of Lady Minto Hospital, which provides home support services and access to facility respite, assisted living, long-term care, home care nursing and bereavement, and community-based MAID support. In November, 1,268 hours of home support were delivered here on Salt Spring Island alone. This is compared to 777 hours from last November. Incredible growth in 1 year. Today, we're keeping 69 people safe to age in place on Salt Spring, more than double the number of people from 2022. We support Salt Spring Community Services to deliver seniors wellness programs like Friendly Visitors, volunteers who visit weekly with seniors in their homes or on an excursion, take them out to offer companionship and brighten their day. Peer connection, trained seniors who help support and encourage other seniors who may be going through a rough patch. Meetings are held weekly for about an hour in the senior's home or elsewhere if appropriate. And friendly voices, caring volunteers who provide regular phone contact to seniors who need more social contact or who are alone or lonely. As this demographic of seniors grow, these programs of volunteer services will be more and more important. In addition to the 29 long-term care beds at Lady Minto Hospital, we rely on many partners here on the island to deliver senior care. They include Greenwood's Elder Care Society, Brayhaven Assisted Living, and Meadowbrook Assisted Living. We know how important and pivotal these programs are to the health and well-being of the people and keeping them in their homes longer. I just want to thank everyone for the work that you do to keep people well at home. We're incredibly grateful to our many community partners who help support our local seniors population, including the Salt Spring Hospice Society, who offers volunteer support services, including vigil services, both at home and at the Lady Minto Hospital, and the United Way Better at Home program, who offer non-medical support to seniors who wish to continue living independently. I want to thank all the partners I just mentioned and the partners in the room for your passion and dedication to caring for the residents on Salt Spring Island. We know that many communities, including Salt Spring and the Southern Gulf Islands, are facing mental health and substance use challenges, and we're certainly seeing the increase following the pandemic in this area of mental health and substance use. We're currently recruiting a peer support worker to strengthen the services in the mental health substance use team provides, incorporating lived experience in the team-based care model. Peer support workers offer support, empowerment, and hope that recovery is possible. Adding a peer support worker to our mental health substance use team emphasizes the importance of the voice of those with lived experience. Peer support will enhance mental health substance use outreach support and seamless transitions in care, and boy, do we hear that a lot in the movement and the transitions of this complex health system. To have an advocate and a peer walking alongside is tremendously helpful. We can now offer mental health or substance use counseling through contracted services, which are accessible virtually. And we continue to contract with partners like the Umbrella Society to offer substance use-focused peer support and harm reduction services on Salt Spring Island 1 day a week. I'm going to put a plug in for Umbrella Society. I'm going off script. Just to say on a personal level how helpful Umbrella Society is to families as well. And they have an excellent podcast, so look them up on Spotify. The voices of people with lived experience. It will change how you see people who use substances. In response to the recruitment challenges for psychiatry, psychiatrists from the Victoria Mental Health Centre are providing virtual consults to people here on Salt Spring Island. Members of the Island Health Mental Health and Substance Use Leadership, which we have here with us, recently attended an interagency community meeting to understand the community's unique needs better. A need for a winter weather strategy was identified, including a need for supplies. Funding was secured for the local mental health substance use team to supply mittens, toques, and socks to the vulnerable population here on Salt Spring Island, and you know who your neighbors are. I want to thank those who've donated supplies today. We have a box at the door. And I want to thank Island Community Services who coordinate this effort. We have a mental health substance use nurse and social worker positioned at Lady Minto Hospital to assist with care and coordination for people accessing those services. And I'm really grateful to the members of the community who work with us at Island Health and the various agencies involved in taking care of your neighbors and strengthening this community. We acknowledge the constellation of services in the mental health substance use space, the many of us who are trying to provide services. It's messy, it's complex. And so we're working this year to make sure that we make that more seamless and have one door in for navigation. You saw in our video that at Island Health, our vision is to provide excellent health and care for everyone, everywhere, every time. It's been such a powerful vision for us to use to rally the 30,000 people who are part of this organization. We constantly strive to meet that vision, and we acknowledge that the current challenges in delivering services sometimes makes that a dream. But it continues to serve as our North Star and a guiding direction for our efforts. You heard this morning, the only way we can get there is when we work together. We work together as organizations, as community agencies, as patients, as members of the community, and as families. We work to create healthier, stronger communities and a better quality of life for all. Our incredible teams are dedicated to caring for this community and to rising to the challenges before them, and they demonstrate that time after time. It takes local collaboration and partnership to address these challenging issues because meaningful action happens on the ground. So I want to end by thanking each of you for being here today, for letting me share a little bit of the work of others at Island Health in health and care, and for your interest and continued support of our teams here on Salt Spring Island. I want to wish you the best of the holidays if I don't speak again, and I'll hand the podium back to Leah.
Thank you, Kathy. I'm really pleased that Dee Hoyano is here with us this morning, our medical health officer. We were a little worried that Dee wasn't going to get here because there was a staffing issue with ferries, but so glad to see you, Dee. And she's going to provide an update on health and wellness of the population of Salt Spring Island. Thanks, Dee. Maybe I'll just stay here.
All right. See if this works here. All right. Thank you very much. Good morning, everybody. So just to reintroduce myself, I'm Dee Hoyano. I'm one of the medical health officers. I'm with the Population and Public Health Division of Island Health. And I'm here today because I am also the local geographic MHO for the Gulf Islands. So I'm really happy to come and hear. I was able to at least join for a bit of the breakfast this morning and here today. And I feel a little bit like what I was going to present today, have to kind of scramble and throw some of it away because Kathy did such a wonderful introduction to so many of the points. So my intention today is really just to touch on how we're doing with our population health by giving you some data, some of the challenges, and also some of the strengths of this region, the Gulf Islands, Southern Gulf Islands. So we're having a lot of conversations today about health services and access to health services. And I just want to emphasize that although it is a very, very important conversation we're having, but to keep in mind that the vast majority of the health of individuals and of communities is from things outside of health service and access to health services, those social determinants of health and how we experience our everyday lives from birth, pre-birth, all the way to the end of our lives. And so I'm going to highlight some of those challenges that we're facing here with that, but also some of the really important strengths of this community. So let me see if this works. So already mentioned, we're talking about where you live, population of about 17,000, and of course the majority of the population is here on Salt Spring Island, but we do have the other smaller islands as well. And one of the things that was mentioned was around the population growth and change, and so that is something that is affecting Salt Spring Island and the Gulf Islands now, and it is going to continue to be something that is in transition over the next years. So, our migration levels here are not as high as some parts of the island, but still in that positive direction. So we're seeing continuous growth. And like Kathy already mentioned, one of the groups that we know for sure is going to be growing in proportion in absolute numbers is our elderly population. And particularly for the Southern Gulf Islands, that population over 75 years is going to increase dramatically over the next 10 years. But the other thing you'll notice here is that the younger population, particularly children and younger adults, is actually going to be staying pretty much flat. And so that has implications, of course, for workforce and the ability to provide services, but also the challenge of having kind of the right mix of services and opportunities for people at all ages and stages of their lives. And that's just to kind of give you a picture of what that change will look like. So you can see that red box is the one that's going to be growing the most quickly in terms of the 75-year-olds. So that's kind of the background context of our demographic changes. And then what we're seeing right now in terms of some of the more important social determinants of health challenges. This is not, I know from the conversations I heard this morning, housing is a huge priority and concern across the country, across the province, and then particularly for this region. And for the Southern Gulf Islands, the statistic from 2021 was that on average, households are spending 40% of their income on housing. This is for renters. And just as a kind of snapshot of the cost, this is from a Victoria stat. I'm sure it's fairly similar in Salt Spring Island. 2-bedroom condo is over $2,000 a month. And of course, the benchmark that we look for is that households are not paying more than 30% of their income, because we know if they are having to pay more than that, then they are having to, by necessity, make sacrifices in the spending that they can do for their other household needs. Unemployment, of course, is a very important social determinant of health. And in that regard, Salt Spring Island and the Gulf Islands does fairly well in terms of our overall unemployment rate. So I think the bigger challenge right now that people are facing is actually the wage that they're earning. So it's maybe not as hard to find a job, but to actually be earning the amount of money to keep up with the cost of living increases is of course, a huge stressor. And what that results in is things like food insecurity. And so we know that this statistic came from the survey that was done during the pandemic in 2021. Almost 9% of people on that survey recorded that they have difficulties meeting their food needs to be able to afford healthy and nutritious food. And that was 9% in 2021. And I have no doubt that that's actually increased given inflation and rising food costs. And this is, across the board. We know many of the efforts I've seen in community here in Salt Spring Island have been trying to address some of those food security issues. So really want to encourage keeping that in mind and how it's affecting, households everywhere. Another really important measure that we look at is our early childhood indicators of health and well-being. And that's important, obviously, not only just for the children and their families themselves, but because we know that the more supported and healthy kids can be getting that beginning stages of life, we know that that impacts their likelihood of being healthy and well throughout their whole life trajectory. So the more that we can support families and children to have a good start in life, then we kind of reap that benefit over the years as they grow older. And one of the measures that we look at closely is what's called the Early Development Instrument. This is a survey that has been started back in 2005, and it measures children at the kindergarten level in terms of a number of measures of their social and emotional development as well as their academic development. And the orange bars here are for the Southern Gulf Islands. So you can see back in the 2005, 2007, it was about 20% of children that were identified as having at least one vulnerability in that area. And it's just steadily increased into the most recent wave, which was, over a third of children are being identified as having some vulnerabilities. So that just really speaks to the risk of our children having a more difficult time, meeting their health needs and developmental needs. And this other one is speaking more around adolescence. So this is a McCreary survey that is done in schools in the adolescent age. This data is from 2018, and there was just one that was completed this past school year, so we don't have that information yet, but we'll have similar data available. And this looked at self-reported problems with mental health or emotional health and long-term chronic conditions or learning disabilities. So this is by school district, so school district 64 is the one that includes the Gulf Islands, and we have, again, a very high percentage of the youth are reporting mental health difficulties. And then, it's a picture that we can see in many, many different parts of the island, but it is concerning when we're seeing that level reported. And unfortunately, I think we are going to anticipate that we're going to see at least that high level, if not higher, with the next go-round of this survey. So the mental health of young people, I think when we, so actually maybe I'll go on to the next because I'll talk a bit about substance use. And certainly I heard that in the conversations today about how much of a concern and an issue that is. And we know with adults struggling with substance use issues, mental health issues, a very, very high percentage of those people actually did have difficulties in childhood, faced adverse events in their childhood. And so as much as we can prevent those, support people through those events, the more likely we are to be able to prevent some of that adult mental health and substance use issues. So this is just showing some of the top causes of death for island health in 2022. And you can see in the top graphs, that's by age group, and that orange or the orangey yellow bar is our cause of death from the illicit drug overdose crisis. And so you can see it's among the top causes of death of our people under 60 years of age. And unfortunately, it has not been getting better over the years. What that means for Southern Gulf Islands, we do have a lower rate of reported illicit drug toxicity deaths compared to the island health average, but that still means 4 people on average a year are dying on the Gulf Islands from drug overdoses. And again, tragedy, this is preventable, and our teams are working hard to address this, but it is a very difficult, wicked problem right now that we're looking at. Also talking about substance use, I think another one that maybe we don't talk about as much though, but is very, very important and from a population health level is alcohol consumption. And this bar on this graph on the left here is our consumption patterns. And so you can see that orange line is the Southern Gulf Islands. So we are consuming more alcohol on a per capita basis than the BC average. So this is for people 15 years and older. And what that translates to is, I've written it down, it's basically averaging about 2.3 drinks a day for adults over 15. And what is that? If you multiply it, 16 drinks a week. And so if you are thinking, oh, I'm not someone who consumes that much, then you realize that somebody else is making up that gap for you. And of course, we know alcohol, chronic use of alcohol has many impacts in terms of health, chronic health diseases, cancers, dementia, hospitalizations. It causes a direct burden on our hospitals. And of course, there are alcohol-related deaths. So again, work needs to be done at a societal level to try to decrease the level of consumption and reduce some of those harms. And it's a tricky one because there's a lot of societal forces as well that have been promoting alcohol consumption over the years. So that's a lot of challenges. I do want to speak to some of the strengths and where I feel like this community in particular does very well and needs to help. We need to help all of us in partnership to promote. And that is around the community resiliency and some of the ways that how that protective that is. So this is looking at mental health and well-being, and this is again measured sort of midway through the pandemic in 2021, and it asked people whether or not they felt they had poor mental health, stress, and weaker community belonging. And actually, the Gulf Islands did very well in that people were actually feeling better about that than at the beginning of the pandemic. And I think this really speaks to the resiliency of the local communities, where people felt supported, they felt like they were in community, they were helping each other through this time. And to me, that's just a reflection of, you know, the capacity that's in this community to support each other. And for me, that also emphasizes the need that we really, really need to support this going forward for everybody from all ages. We saw the youth are vulnerable here, and then all the way up to the, you know, seniors and needing to feel that belonging, the ability to contribute to society, and you know, feeling safe and included. So I think the work that I see here, and we'll probably hear more about from David in terms of the health networks, but also all the other sectors that support people, is something that you need to remember. You know, remember that it's improving everyone's health, individuals' health, and that we, you know, you've demonstrated you have that capacity to do that. So that is all. Thank you.
Thank you very much, Dee. I want to urge people to never lose sight of how important population and public health is to our health. And sometimes it looks like they get to take a back seat to acute care and other things that are going on in the system, but they do laudable work, and we should be entirely grateful to them, and I'm certainly grateful to them. So we're now moving to a presentation on mental health and wellness initiatives on Salt Spring Island. And just one note before we go there, our board may have questions for the presenter, which they will ask immediately after the presentation. If you, the public, have questions, there will be a Q&A portion at the end of this morning, and we'll ask you to save your questions until then. Our presenter is David, and David, I fear I've mispronounced your last name, so I don't know whether it's Norget or Nordget. Okay, perfect. David's the co-chair of the Salt Spring Health Advancement Network, and I invite you to the podium, David.
I'm not sure I want to be tethered to this, so I'm just going to decide whether I take this out. I've always been a mover. I actually used to be in special education and supporting so-called behavioral kids, and I would teach them how to appropriately move. In one case, I was sharing a story where I just said, I'm going to arrange with the teacher that you need to go to the bathroom a lot of times. And it's not that you need to go to the bathroom, but you need to move. And they were looking at me curiously, but they came to understand this was super helpful. So Nathulth is Hulkaminum for good morning. Bear with me, I don't aspire to public speak. I'm willing to do it. I really see it's important to be human beings, and actually in terms of community, I think the community and good community is the antidote to a lot of mental health issues and a lot of issues all around. So I'm appreciative that we're speaking to relationship building and the connections. I'm here to be of service to everyone here. This is where I think it's really important that we're remembering our humanity. I greatly appreciate, and this ties to the slide here, these are welcome polls down at Huaquam, which is commonly referred to as Burgoyne Bay. The late Tuseelam, Ron George, is an elder from the Cowitson community. And I once asked him, well, how can I support what you're trying to do? And he said, I want you to walk the land. And I appreciate that in the video, there was both land and commentaries on people. And I think both are really essential, and it's why I'm so appreciative that we're here on this land, because I think the land is our community, just as each of us are community, and to listen to that and to connect to it and to be here is so vital. So I'm glad that this picture is up there. And I was fortunate that the Tuseelam, the late Tuseelam, I had lots of time with him and lots of laughs. I'm not sure what I'm pressing here, just the forward arrow? You lied, Tyler. Oh, I didn't even press it that time, just a lag time. Or did you do it? Okay. Just, so the human side of things. So I was born in Treaty 1 territory, which is Winnipeg in my case, lived in Haudenosaunee territory, Montreal, and then lived in Stockholm, Sweden, which is part of my roots. My heritage is all European, Christian, and a little bit of Jewish in there too. So I think that connection is also really important. I don't even know what else is up here. I'm not going to read through all of this. 2 stories. One regarding Lady Minto Hospital. I've had 2 family members die in that hospital. And one was my father in 1989, and I was with him to his last breath. More recently was my former stepfather. He also died in that hospital. And in both cases, I was held in that holding. And it's very dear to me. I don't think of the hospital as my home, but it's a very dear place for me. So it really speaks to the power of the care in small ways that I received in this local hospital. And I think that's an important piece. The other story is we're friends of my partner who... They're both doctors. They work in the Cathet area. And I said to them, I was curious, I was getting to know them. I said, well, me as a patient, what I really want is I want to share my pieces with my doctor, and I want them to tell me what's going on, and then I want to attend to what's going on and make my choices around my own care. And I said, how does that land with you? And they said, that lands really well. We'd love to have you, not that they were looking for a patient, but we'd love to work with you in that regard. We'd love that. I thought, okay, great. And I'll come back to why I'm mentioning that story. Did you do that or did I do that? Okay, I'm just going to point to you then. Just a reality check here. So the history of Shan, it was actually born out of a physician recruitment committee. And there is quickly a recognition that what are we recruiting people to, and the environment and the community that people are coming to, whether that's the hospital or the larger community, is really vital. So we want to come in where there is a sense of, I'm just going to raise this, a sense of well-being and connectedness, and really, let's just call it community and strong relationships. And there's a lot to build strong relationships. So it quickly expanded in terms of understanding the needs. Our 2 main focus areas are mental health and seniors. So this is lining up in the conversation. And there's obvious overlap to that. Just an example, I know of firefighters who get a call to a place. Actually, it's a senior. They can't chop their wood. The firefighter chops the wood for them. That's community, and that's the kind of loneliness and belonging and supporting these pieces. The Shan meets monthly. It's an amalgamation of a lot of organizations, and I'll list it up there in a little bit. Go ahead, Tyler. So the vision is healthy people, healthy communities. When we have healthy people, we have healthy communities, and the opposite is also true. When we build healthy community, we create healthy people. Our particular mission is around improving community health and well-being. So this ties into the social determinants of health because it's all connected, and actually holding that interconnectedness is so important. So that's through networking, so relationship building. It's through advocacy, it's through information sharing, and it's through collaboration. And I don't use that word collaboration lightly. I actually come to appreciate how much is involved to actually collaborate. I actually start with cooperation. That's a starting point, and willingness. And with time, then it becomes a collaboration. It actually takes quite a while to get there. Oh, I like that. I like this even more. So guiding principles, be community-based, involve individuals, and that includes reaching out to community and to individuals, especially those that don't have the voice. So that's where I feel like in my privilege, I am there to be of service to the reaching out and the connecting. Have a proactive, so design or default, life by design or life by default. This is life by design. How do we design into what we want more of? collaborative, inclusive, cohesive. You're going to see the pattern here. Intentional processes, so the collective impact model is a really important one. What is in the best interest of the community, and making sure the anecdotal stories are valuable data and is data, but also the other data. So I really appreciate your presentation, Dee, in terms of that data. Yeah, working towards the integration. We can't see ourselves disintegratedly, or we are going to disintegrate, and that is what's happening. So it's about integration, and in some cases it's holding the complexity, and in some cases it's coming together to discuss and build that understanding, not rushing too quickly to fix, but let's gain that collective understanding. Yeah, I think it's all pretty apparent. So membership, I'm not going to go through all of these. It's broad. We have active members. We have associate members who receive the minutes. Again, to do this kind of work takes a lot of effort, even to get people understanding that it's important, can take a lot of effort. And my approach has always been keep going where those people are already there. And more I'm seeing in this community leaders that they get it. Okay, yes, it's not, let's venture in. So the willingness goes a long way, and I'm appreciative of that. And so that's a very positive thing. Hey, you knew already. Wow, we're really getting close here. Community participation. Oh, I see the slide kind of went weird there. So Shan we're part of the Collaborative Services Committee that's in dedicating towards a primary care network, basically building a network of care and support, and underlying that is also how we support each other. And there's an Island Health connection. I've done the asterisks just so it's helpful being part of Island Health to understand connections into the Salt Spring Health Advancement Network. We also participate in the Southern Gulf Islands Health Advisory Network. That's where all the Southern Gulf Islands meet with Island Health decision makers, and there's an integrative aspect in there. Each island is quite unique, as I'm sure those of you who sat on this can attest. I see Jess nodding her head. Ask Salt Spring, so there's a connection in with engagement in the community. Ask Salt Spring, for those of you who might not know, it convenes around different topics. It also, like Adam Olson will come and the community can meet and discuss, and it's very dialogic, which is I really appreciate, and they do an amazing job. That's the Salt Spring Alliance. The Salt Spring Community Health Society is a charitable partner of one of our initiatives, the Mental Wellness Initiative. So really thankful for the work with them. Our Cowichan Community Health Network, Cindy Lizet is a mentor of mine. They're doing incredible work, and that is that community health network model, nothing about the community without the community. Obviously, connections in with elected trustees. Adam Olson's been a great partner and advocate and helped set up a connection with the Minister of Mental Health and Addiction, so deepening the conversations that's tied in with the Mental Wellness Initiative. No. So key context of Salt Spring, some of these things have been mentioned. We're rural and remote. We don't have the breadth of services that the cities have, and that brings its challenges. We are an island. Access to services away is made more challenged, especially if this is people's homes, and then being in another community, there's discord there. We do not have a municipal structure. We have the highest, as far as I understand, in BC percentage of per capita community members who are insecurely or unhoused. That comes with another plethora of other issues. And so as somebody mentioned, it's complex to hold. And so it becomes really vital that we're coming together in how to wrap around care, even in some cases, I would say, to see them as community members. That stigma is an issue here for sure. And I thought it was 30 to 40%. I was kind of adjusting the attached or unattached, but okay, 50%, whatever it is, there's still an issue around that. So current efforts, I mentioned some of these, the mental wellness initiative, and this is thanks in part to Island Health Community Wellness Grants, so I'm just making that connection in there. We're advocating for regular community health network funding. I'm a deep believer in community health networks, and I love this about Island Health, that there's been these grassroots supportive pieces, and I want to fan the flames of that. Yeah, I recognize it, and I like more of it. It would be great if we could have a coordinator position to provide the glue role and support, especially around a seniors initiative. We have great data and info around seniors populations. It's a little old, but I'm sure there's a lot of the same issues that are there. So that would be a great supportive piece. The Collaborative Services Committee, that's been mentioned, the Primary Care Network, and a community health center. That would be a great addition. And then we have our own strategic plan pieces that we're paying attention to. A lot of it is relationship building, capacity, connection, more initiative. So it's all interconnected. How can you, and I don't mean necessarily you, but Island Health support our community well? The community health network funding, that would be great, and it would support the community building and what we're talking about, and that would be a servant leadership in terms of supporting that. Continuing to allow and support the partnering. I was an emergency mental health clinician to Lady Mitchell Hospital a little bit, and there is a kind of there needs to be confidentiality, but there also needs to be wraparound care in the community. So how do we broaden that bubble of care? And that in some cases, that's permission to allow that, but that's part of the partnering too. And yeah, the community health center I mentioned, holding the principle, nothing about the community without this community. And I don't say that to say, oh, you're an outsider. I actually say, you're part of this community, you're an insider. So that's in that partnering. It's not about looking, I think this is a societal piece where we look for our parent to fix something or the government to fix something, same idea, rather than encouraging the partnering coming together. I think that might be it, but let's see. There we are. All right, thank you very much.
This is not on, right?
It is not on.
It is not on.
I can vouch.
Is that better? Okay, great. Thank you very much, David. That was really fabulous and interesting, and your partnership is really important to us. I want to give my board colleagues an opportunity to ask questions, if they have them, of you before I go to the audience. Diane?
It's not a question, but it is an observation that you have something really unique here, and your PowerPoint, I think, along with your thoughts along with it, absolutely make sense in this instance, and I'm really impressed. I've been around a lot of organizations in cities and towns and districts that attempt to do this, but I don't know if it's has to do with Salt Spring or if it has to do with your personality. But what you showed us today is really tremendous, and I'm very impressed.
Yes, I echo my colleagues' words. I was wondering, is there the one thing that Island Health could do that would help facilitate your plan or your dream for the island?
I would say the Community Health Network funding piece. And really that would go through the Greater Victoria Community Health Network. And there's no way that Kirsten Ma is the coordinator of that. There's no way she can hold, well, Victoria as a hold in itself, but the extended Greater Victoria, that's quite an ask. So I say that because then they can support a position here. That's why the only reason I say funding there. I think community health network funding is an amazing thing, however it happened, and I would just fan the flames of how to make sure those community health networks are supported. The work that's happening in our Cowichan is ahead of where we are. That's an incredible thing, and so more of that. How do we support the communities and the work going on and the great people? There's lots of great people. Fan the flames of them.
Excellent. Well, thank you very much, David. We really value our community partnerships and appreciate you coming this morning and, first of all, talking to us at breakfast. That was very interesting as well. And your presentation was excellent. So thank you for being here today.
Yeah,
it's really appreciated. I want to open the floor now to questions from you, if you have some. I don't think we have any that have come in by email. And just while you're getting your questions in your mind, I want to acknowledge our communications team and our multimedia team, who without them, we would not be here. We would not be having this public forum. It would not be what it is at all. And Tyler, thank you for being the clicker for David. We get here because all these folks help us get here. So thank you very much for your work. Would you like to stand up?
Thank you. Thanks. All these presentations were just excellent. Thank you so much. So a little bit about my question is, I am a hospice volunteer here on Salt Spring. And before that, I worked in financial aid and at BCIT, and I worked with nursing students who had some of the highest debt loads of the students in our institution. And so my question is, relates, Kathy, to what you were talking about, the health staffing challenges that you're facing. And I'm wondering if you have a liaison with Student Aid BC and the Ministry of Post-Secondary Education, because there is this wonderful program called the Student Loan Forgiveness Program, which allows graduates of healthcare programs, and this would be doctors, nurses, medical technologists, lab assistants, the whole array of people who are working in healthcare. It allows those people to have their student loans forgiven if they work 5 years in a remote rural community. First problem is lots of people don't know about this program. And I can tell you, having worked with students my whole life, getting a free education would be an enormous recruitment tool. So getting that word out is much more needs to be done because people don't know about it. Young people don't know about it, that they have the opportunity to graduate. So what I'm asking you, Kathy, is whether you can talk to the people in Student Aid BC about how to get this word out there in our province, but I mean obviously Island Health. I'm asking you, and I'm also asking you something even more specific, which is that for some reason in Salt Spring, it's not a designated community for this program provincially, but it is federally. That's just a mistake that someone's made. I've written to the Minister of Health, I've written to the deputy ministers, asking them to look at this, and I've got a letter back from the executive director of Student Aid BC that did not address my question. So I don't know what to do. I need somebody to bring this forward. Do you understand what I'm saying, first of all? Because I'm talking too much, sorry, but I just want to make sure that you understand. There's this bigger question of getting the student loan forgiveness program awareness out there, and then there's the second question that Salt Spring is missing from the list of designated communities to access this program provincially, because there's both a federal and a provincial student loan forgiveness program. Thank you for your patience.
Thank you, and I missed your name.
My name is Connie Gibbs, and in my retirement, I'm a hospice volunteer. I go to Lady Minto every week, and I socialize with some of the residents in the extended care unit who are, as you might expect, really lacking in social connection.
Yeah, thank you, Connie, and thank you for being part of the team. because when we don't have enough of our island health workers, you actually hold up the care that residents are receiving. So thank you for being part of that team. So 2 questions I heard there. One was about getting the message out. I think to people as they're choosing their educational pathway, letting them know that this loan forgiveness is part of that, helps them make that choice right at the front door. And just thank you for saying that. I think we have a team that's dedicated to what we call a Health Human Resource Sustainability Initiative, working directly with the provincial government on what's now almost $1 billion that the provincial government is investing in health human resources. And there's a very clear connection with the Department of Advanced Education. Most of that has been funding additional seats, but that is the pathway we could use to make sure that we are advancing that discussion around loan forgiveness. And I do know loan forgiveness is part of the package, and my colleague Krista Allen, who's our chief nurse, is very connected to that. So Krista, maybe I'll ask you to add. Just before I pass the baton to Krista around the loan forgiveness piece, the second part of your question was rural and remote recruitment incentives. And really happy to say we were able to, we had a crisis in the North Vancouver Island. So rural and remote service delivery is challenged across Canada. It's challenged across British Columbia, and it's challenged in Vancouver Island. We saw the first, although tremendous efforts made here in Lady Mento to keep our emergency department open 24/7, and I just need to acknowledge the efforts of the leadership here to do that. We weren't so lucky in North Vancouver Island, and we've had to reduce access to one of our hospital emergency departments to 12 hours a day. So we have a major initiative happening there, and one component of that is an incentive for taking permanent roles. That incentive will be extended here to Salt Spring. We had a pilot project, and that will be funded through the province. So they're looking at the extension of that rural and remote incentive program. I suspect the list of communities that qualify for the provincial and federal loan forgiveness will also be connected to that incentive. So it makes no sense to have a different list for an incentive and another list for loan forgiveness. So I suspect there'll be some harmonization there. It's just going to take us a little bit to connect all those dots. But Krista, did you want to add anything to either one of those?
The only thing I would add is I really appreciate you bringing this forward, particularly about Salt Spring, because there are things that we don't know that we obviously are at provincial tables around bursaries and different initiatives like seat expansions for nursing and allied health. And we need to bring this forward because I do think it's an important thing to take forward and talk to them about the connection. There are more supports for students than there ever have been. It's hard to get an avenue or a mechanism to get that out to everyone. And I think we need to do much more to let individuals know the options and opportunities for whether it's loan forgiveness or bursaries locally within, I think, Vancouver Island, but BC, and also bringing internationally educated students to BC too. So we're going to take that back, and thank you for raising that, and I'll definitely bring that to the provincial tables. Thank you.
Ron?
Thank you. I've been involved with the health system for many decades and in many roles, and I have to say this is one of the best presentations I've been at in a very long time, both in content but and also how you presented it. So sincerely, thank you very much. David, I'd just like to ask you a question. I thank you for highlighting the primacy of relationships as well, which is key to collaboration. I noticed there's a lot of networks you had up on your slides, which is great. It's also a bit concerning in the sense of you can get into this idea, this notion of silos of networks, the siloization of networks, which is a problem. And I'm not sure how connected the networks are, but I'd like to learn from you in terms of, is there work being done in terms of how these networks can be somehow connected through some kind of constellation, rather than running the risk of siloing networks and being somewhat competitive when we could be more cooperative?
Yeah, I appreciate the question, and it comes up certainly on the island. There was another group I didn't even know about some years back, and it seemed like there was overlap, and so we amalgamated. It doesn't make sense to reinvent wheels. So really our connection to other community health networks are just more in a mentoring and learning capacity, but within the island, I think absolutely, let's be together and let's eliminate duplication, because that doesn't help anybody, which is also why it's so important to come together on multiple levels to do wraparound care and confidentiality agreements, et cetera.
Thank you, David. Any other questions? Gee, you're a quiet group. That never happens. I usually have to cut it off at the end. Well, as a governance board, we are accountable to you and to the people we serve in communities around Vancouver and the surrounding Vancouver Island and the surrounding islands. And that's why it's so important for us to provide opportunities like this to hear from you. I want to thank everyone who was able to stand up and ask a question. Sometimes because of our virtual connection, we have people asking questions virtually, but not today. And so Kathy, Dee, and David, thank you so much for your presentations. And to anyone who did tune in virtually, thank you for being with us. Before we do wrap up, though, I want to take this opportunity on behalf of my board and staff colleagues to wish you the very best of the season. David, you said you had some Jewish background, and today is the beginning of Hanukkah. And some people will be celebrating that, and others will be celebrating Christmas. And whatever your celebration is, I hope it's great for you over the holidays. And thank you so much for being with us today.